Hi everyone and welcome to Clinician A Click Away. Before we start, we'd like to acknowledge the traditional custodians of the lands on which this meeting is held. We pay our respects to elders past and present and emerging, and the land on which we live and work. So my name is Weh Yeoh, I'm your host for today, and joining me on this episode of A Clinician A Click Away are my two Umbo co-founders, Ed Johnson and Francesca Pinzone. Good morning, Ed and Francesca.
Hi, Weh.
G'day, Wei. G'day, Fran.
So you guys are really perfectly positioned to be talking about this topic of what is online therapy. And without giving too much away, obviously, Ed, your research is showing up some interesting findings into how online therapy works in practice, particularly in rural and remote Australia. And Francesca, apart from being a wonderful nurse and having great background in social impact, you're also a wonderful mum of a kid who's received speech therapy. So kind of bringing some interesting perspectives to the table today. So what we're really going to talk about, of course, is what is online therapy? Why is it possibly or maybe definitely the way of the future? And then we'll just try to unpack a little bit about how we see that moving forward. But the first question is, for our viewers and for me, what is online therapy? And is it the same as telehealth, telemedicine, and telepractice? Ed?
Thanks, Wei. Yeah, starting with the easy questions. So I guess, a lot of people listening to this would have heard of the terms teletherapy, telepractice, telemedicine, but maybe not as many have heard of online therapy. And that is a term that we use at Umbo to get away from the baggage that those other terms carry with them, in a sense, because there's a lot of preconceived notions about what digital practice is and what online therapy is. So we want to be able to start afresh and leave those opinions behind. So online therapy for us is very diverse in terms of who it can help and what it can do. But in the past, things like teletherapy and telemedicine, they're very much focused on a prescriptive model. It's very much focused on interventions which are standardised and helping people to fix problems rather than looking at things through a disability lens, which is it's very different, turning things on its head and looking at supporting people to achieve goals in their life. So that's going to be, by its very nature, very individualised and very different for each person. I think some people have in the past limited and continue to limit what they think online therapy or telepractice can be, because they have that notion that it is prescriptive and that all that it is video conferencing. Whereas in fact there is a lot of different technologies that we use in online therapy, and so we take an approach that we want to support key workers and coach people. So we don't necessarily do one-to-one therapy all the time. It's often doing things like coaching people at the other end through sharing documents, sharing videos, coaching them through phone calls and data sharing and things like that. We can get a little bit more into exactly how that works probably a bit later on in the show.
Yeah, and you mentioned, just to leap forward to this idea of coaching. So maybe Fran, particularly on the parent side, how would you think that would work for the families that receiving therapy? Is coaching a good option perhaps, or does it sound like too much effort maybe?
No, I like the idea of coaching, and I think what we sometimes forget, and the speech therapy that we had was amazing for my son, but I was doing it solo, and it was just me and my son and my husband and the work we had to do with him to get him kind of to the point he needed to be. But we tried a lot to engage our preschool, his preschool teacher, and it was really tricky. And it would have been really nice for me to have someone who was in his preschool who also was on the same page as we were, helping him on a kind of day-to-day basis, and in a group setting when he was with his friends and kind of hanging out, just having someone else there who was kind of participating as much as we were. So I think the idea of coaching people is one that it kind of takes that burden off just being the parent, being the only person who can help the child. It also means that you are bringing in other adults into their life that, we move away from community so much when we become, I think, this idea of raising your children in a village has gone, really it has gone, and you're kind of quite isolated. And so to actually have other kind of supports within kind of the raising of your child in any way possible, I think it's really important. So I think coaching is a great, and also you're upskilling other people all the time. And I think that's a benefit that, as your preschool teacher or whoever it might be, they're getting a really good benefit out of being part of that kid's life and coaching, and then they can use those skills with other kids as well.
And do you think that people might like the ideas you've explained it, but when they initially hear about online therapy, what kind of reservations do you reckon people might have?
I feel like there's this really archaic sense, particularly when you say telehealth rather than online therapy, that it's like, I don't know, back in the dark ages or something with a radio and, dialing in and I don't know. But I think there's so many advantages of, like for me, I'm, well versed now with online therapy and what it is, but I do see people kind of thinking, well, it just can't be as good as a face-to-face interaction, or in person. I shouldn't say face-to-face because you will be, but and we're so used to that real medical model of two people sitting in a room having therapy that the thought of moving away from that, it's hard for people to change, I think. So really kind of, it just takes a bit of time to really understand what that looks like and what that feels like as a parent. I mean, look, any kind of therapy that helps you navigate that kind of tricky time with your kids is, welcome, be it online or in person. But I just think, there's so many advantages of online therapy that we really need to share with families.
And in terms of the advantages, obviously the evidence is getting stronger. So without giving us the 5,000 page summary of your PhD, can you just maybe, Ed, outline some of the key things that you found in the evidence? And also why, if the evidence is so good, how come it's not more common in Australia at least to do this kind of online therapy?
Yeah, good question. I think it's not just me who's been looking into this kind of stuff. It's there's quite a few people actually from Sydney Uni, from UQ up north, and there's a lot of really kind of in context research happening as well. These are real life case studies that are happening, and they're kind of incorporating all the parts of the puzzle that you have to put together before you can actually get to this point, which is what part of the strength is of the cases that are coming out here. So we're considering things like NDIS funding, travel time, the kinds of issues that people might have either as clinicians or as consumers with technology during these interactions as well. So we're having a really good look at real world situations in this research. I think one of the great things that has come out of the case studies that I've done is that we can see that parents really aren't phased or aren't focused on the technological aspects of this therapy. And you might be able to back me up here, Fran. I think it's something that they don't see as the meaningful part of therapy. It's just a means to connect. And if you're connecting and building relationships the right way, then you almost forget that it's digital rather than in person. So that's been a really nice finding. Also a really nice finding is that, or perhaps concerning in some ways, but the more open people are to these kinds of service delivery models, the better the results are. So the people who had more experience in terms of advocating or being exposed to therapy, so if we were connecting with key workers through schools, for example, they were able to get better outcomes no matter what the clinical diagnosis was. So it wasn't related to the complexity of the case, so to speak, the clinical complexity, but it was rather related to the support around that person, how much they knew, their own mental health, their own kind of point in the journey through, grieving that they had a child with a disability, and moving into figuring out together what the goals were for with that child for the future. So I think a reason why we're not seeing a lot of clinicians take this up and not a lot of clinicians talk about it is probably in a way related to the kind of research that you can do in this stuff. So complex disability is not something where you can say, okay, I'd like to gather around 300 16-year-olds who present in exactly the same way and live in exactly the same rural and remote locations, and then kind of compare them all together. What you have to do is look at things at that fairly low level of evidence, kind of level 5 and level 4, where it's case studies and case series. So we're not able to do randomised controlled trials with this kind of stuff unless you're looking at, say how well the technology performs. Yeah. But we've got that data anyway, so it's not as relevant. We need to look closer at developing this technology for those more complex clinical cases, because we have a fair bit of evidence about things like stuttering, coaching people in keyword sign, doing speech interventions for kids as well. So the evidence is out there for that really prescriptive stuff that we think of when we often think of teletherapy, as that kind of video conferencing. But for the more complex stuff, it's going to take longer for the culture to change and for the climate around that to change, because we simply don't see disability as sexy when we're going through uni and we're doing our clinical placements and we're kind of getting out into the workforce. It's often not seen as a priority for people to get involved in that kind of clinical practice. And then, I mean, that over the years has resulted in a lot of people not focusing on that area of clinical practice, so there's not a lot of expertise out there.
I mean, I want to talk a little bit more about the prescriptive versus complex type cases, because it seems like that's really important for the kind of work that we do. But before we do, you mentioned the word key worker a couple of times, and I just wanted to help us all understand, I guess, what is a key worker and why is the key worker so important?
Yeah, good question. It's a key worker is basically the person who can bring together clinicians and bring together the family and bring together all of the information that they need to meet their goal. And what I try to do is when I look for key workers in someone's life, is I try to find someone who's not a family member, because I find that family members as key workers is a bit fraught, because it's hard to live your life as a mum, a dad, grandma, granddad, and also kind of case manage, someone who has a complex disability. So to be able to make sure that you're on time for appointments, that you have all the information that you had from last time, so you can update your therapists on what's been happening, so that they can try to guide you in the right direction in the future. Often it's the case that this will be a local community worker. It's not always difficult to find this person, but it can be. Sometimes people will have funding for an allied health assistant in an NDIS plan, and that person can sometimes act as the key worker. In other cases, we've partnered with Aboriginal medical services, Aboriginal health services, where we can get key workers to be people who are already engaged with the families who are health workers in those communities. So they have an expertise in that community and know about the culture of families around there. They often know the family directly, and they can be the people who gather the information, give those families prompts to kind of engage in the therapy in real time in the context, away from therapy sessions, and also kind of make sure that they bring them to therapy sessions, get them there on time, and be able to keep those communication channels open.
Okay. So key worker is someone who's really engaged, and obviously that makes a big difference, as you would probably assume, in the outcomes that the kid's going to receive. Yep.
Certainly. From the case studies in my research, there's been a lot more success when we've had someone who is experienced in their role, whatever that role might be, whether it's a specialist teacher who's supporting communication and occupational goals for kids at school, whether it's an Aboriginal health worker, whether it's an early childhood interventionist. In all of the cases that I did, the more experience they had, the more knowledge they had, the better outcomes that we got. I mean, it was a small set of case studies, but so we can't draw too many conclusions from it. But it did look like we were getting better results from better key workers.
Okay. And now, Fran, to throw it back to you, so you kind of use the analogy of teletherapy, telehealth, telepractice. They're all quite archaic, like rotary phones. And then if online therapy is the way of the future, how does the approach of Umbo differ from the more archaic practices? And then I guess not only like how does it differ, but why would that help a wider range of people?
Yeah, I think there's a couple of reasons. I think what Ed has explained around this coaching model and key worker, that to me seems different in itself as an online therapy provider for Umbo, which I'm not sure that we have seen in other kind of organisations that offer online therapy, because we're not the only one. So I think that we haven't kind of really seen this real coaching model and this desire to kind of upskill and work with communities much broader than the individual kind of family or individual child. I guess the other part of it is that, there's so many benefits that I can see as a parent to online therapy that, is really good for us to communicate. So it's not just around kind of having access, because I think that's the key thing we're trying to solve as part of Umbo, is that there's so many families that don't have access. But it's around kind of, I was thinking about this as you were saying it, Ed, this, when you invite someone into your home, your therapist is a trusted person. And so when you have them on the iPad or the computer, they're kind of in your home with you and they're seeing what happens on a day-to-day basis. And I always go back to this idea of, you may try and describe a lot to your therapist what happens at home. You may describe, well, when we have dinner, this is what happens, or when we're going to bed, this is what happens. Whatever you describe is never exactly what it is like. And your behaviour is always different as a parent. And so I think having that person on the end of the phone, the iPad, coaching you through that time, it's absolutely invaluable. And you've got someone to back you up and help you. And whether it's you or the key worker or, whoever it might be, or your therapist, kind of you're working as a team to help you get through that kind of time or process that you're going through. So, when you're having dinner, and if you have someone who may have some sensory kind of issues around eating, you can actually show what's happening there at that time and have your therapist help you through that time. So I just think there's so many kind of really valuable parts to online therapy beyond this idea of kind of a coaching model or, access.
Yeah, so you mentioned, these sort of benefits of being able to see it live, I guess, or in its natural environment. I shouldn't refer to children as it. In the natural environment of the person who might be a child. What about in terms of, because I remember you talked previously about you have more than one child, right? So when you have to take a child to an appointment, how does that work with other kids? And then how would this be easier as a parent?
Yeah, so I have the best photo, which I should have shared, which is my oldest and youngest child wrestling in the hallway of the clinic while my middle child was in there having his therapy session. And there was another child in, the next room having their OT session. And I just kept saying, be quiet, stop it, like this. And there was a big staircase and they're about to fall down the stairs. And this is a 2-year-old and a 6-year-old, like jumping on top of each other for the half-hour session. And I just kept thinking, oh my God, it has to be easier than this. Yeah. I have to take, all of them to this session. And if I bring them in the room with the therapy session, which I used to have to do, especially with my daughter who was 2 at the time. She's going through all the cupboards and the doors, and then she had the game she liked to play, whereas my middle child who was having therapy was trying to concentrate. So it is really challenging. And then I didn't even have the challenges of what it must be like. When you have a child with a disability, you may be looking at wheelchairs, you may be looking at, feeding tubes, peg tubes, things like that are so hard to manage, and you do it because you have to, but do you have to? And this enables you the opportunity to not have to. You can be in your pajamas, your child can be in their pajamas. You're not disturbing their environment to take them out to a therapy session. So I think that is another really important thing, is it's actually easing that stress that you feel. And if you've got a child with a complex disability, this may be one appointment of many over the course of a week, so if we can actually cut that time that you actually have to run around after, then that's just a benefit for families.
Okay, so that covers the location issue. So obviously location is a real benefit. What about timing? When would be the best time for, let's say, an occupational therapist or a speech therapist to see a child?
Look, I'm not sure. I can't speak. I think every case or every child is probably different. And often it's when you've identified there's a problem, and that's what we do. We identify there's a problem and we ask people around us, and then we do a quick Google search and we find out what we need to do, and then we try and book ourselves an appointment. So I think the timing often is related to, what you have. One thing I think around timing that's really important is that we talk a lot about the key around early intervention, particularly for kids in that preschool age. And that, you really need to get therapy before they're 5, depending on what it is, and I'm probably oversimplifying things. But, early intervention is key. You must get therapy, and if not, this will happen and this will happen. Now, as a parent, that is so stressful and anxiety-inducing, and you constantly think, oh my gosh, what am I doing? But if you can't get an appointment, your stress and anxiety is rising with every moment because you're thinking you're doing your child a disservice. And that I kind of see as something that happens to families in regional areas, is if they can't access therapy, like your stress levels, would be rising because of, not having access. So it's quite complex, I think. There's so many different parts to it.
Yeah, and I guess so it's a really good segue, thank you. So it's complex, it depends on the diagnosis, it depends on the family situation, who's around. And I guess online therapy needs to be flexible enough, and the clinicians need to be flexible enough to work around these issues. So Ed, people probably want to know, how does it actually work? Because you said previously it's not just hopping on Skype. So tell us, what sort of technologies do you use, and logistically, how does it work?
Yeah, so when I usually speak with someone for the first time about this, they ask me what I do, and I say, I do online therapy. They'll say, so you mean like Skype? And sure, that is part of it. It can be a big part of it for some kids if it's that really traditional kind of prescriptive approach that we're taking, because it's that kind of issue that's come up. But most of my practice has been, since I graduated nearly 10 years ago, has been intellectual disability. Helping people from cradle to grave who've had intellectual disability or mental illnesses. And that's something that you need to approach in a very different way. It's often the case that you can't engage directly with someone on a video call. If they've got an intellectual disability, say if it's a severe intellectual disability, they might not recognise that there's another person at the end of the screen, or the other end of the app. They might not recognise the value of what you're trying to do. They might not be able to tell you what they want to work on. So it's often the people around them that are supporting them to get to these goals. So in person and online, those are the people who you've got to focus on. So that's where this coaching stuff really came from. And the kinds of tech that I use are fairly basic. So we use a
rotary phone.
Similar to the pedal radios that the Royal Flying Doctor Service used in 1929 when Alf Traeger invented them. So, just a quick aside. Online therapy is 91 years old this year. It's not a new thing. Just to let you know that the RFDS has been doing it for a very long time. So the kinds of technologies that we use. So I do use video calls, and what I'll do is use something called CoView. CoView is an app that gives you a static link that you can send to a client. They can come into your room when they're booked. And you can interact with them the same way that you might interact on Skype or Zoom or something like that. So you can share documents on there as well. You can share files. You can write on a whiteboard in there. You can do instant messaging, all that kind of thing. But one of the most important things is to consider what the goal is, and that will dictate what kind of technology is used. So if someone their goal is to be able to order a coffee at the local coffee shop independently, but they don't have any verbal language, we might think about a strategy to kind of bridge that gap. So I would think immediately in that case something like a community request card, which is a little card that might say, hi, my name is so and so, can I please have whatever it is, here's the money in my wallet. And that's a strategy that can be used by people in with various different kind of cognitive abilities, various different skills as well. So it can be a fact that someone might understand all of what that says and they can almost say it all, or someone who's completely, apparently disengaged and might just be able to hand it over and not look that person in the eye, a broad spectrum of people. But in that case, you might be able to check up on how that's progressing by calling a key worker. You say, how was it going today? You might be able to get them to take a video, to save that video and to send it to you, and then look at it, the next day and go, oh, great, that really worked well. Maybe we can try to tweak this little bit here. Can you see if you can give him the card earlier and explain what's happening, something like that. And maybe they might give you some immediate feedback by messaging the therapist and saying, oh, it went really well today, but we've lost the card, how do we make another one? Something like that. So that's one example, but we'd be here all day if I told you about all the other different kinds of strategies that I might use.
Yeah, so there's clearly no one cookie cutter approach. It sounds it's sort of horses for courses and being inventive, which is a lot of therapy anyway, isn't it? Really, most therapists have to use their imagination at some point.
Yeah, I think that's something that I get a bee in my bonnet about sometimes is allied health needs to be more creative. I think especially disability practice, you've got to be really creative. I mean, you walk into someone's life and within a few hours you've got to be able to sometimes figure out with them what their goal is, but no one around them knows, and that person can't tell you with words. So how are you going to figure it out, and how are you going to get there? You do need to be really creative, really switched on in terms of listening to people. So it's something that I don't think we put enough value on. We do use this cookie cutter approach too much, and I think the more time we spend listening, and building relationships, which I think we can do through key workers, because they give us vicarious trust with the family, because they are closer, they are more connected in terms of community with that person, then we can get better relationships, better results, and be more creative together and kind of trust in that process.
And so you talked about a number of different types of conditions where online therapy works. When does it not work? Are there any conditions where you can kind of say, oh no, it's not the right approach?
I'm of the opinion that because I've been doing this for a few years now, any area of practice that I'm competent in person, which being a rural generalist is quite a few. So anywhere from child speech and language to supporting a 50-something man with the mental health issues, to working with a mum who's figuring out how to feed her new baby, to anything in between. I've done it online and got good results. So I would say that it's really connected to the ability of the person to coach. I think it's in some ways there are some limitations with OT, or could potentially be, I should say, limitations with OT because of barriers that I see, like being able to fit out home modifications.
That's occupational therapy.
Yes,
Yep.
yeah. So if, for example, someone wanted that kind of thing right now, I don't know that we would be able to provide that, mainly because my background is speech pathology, and we don't have someone on our team at the moment who has figured out just yet how to coach that. But I think with the kinds of technologies that are coming through at the moment, things like physio who are measuring gait and measuring movement and gamifying all this stuff at in their practice now, it's a natural movement forward, and it really is something that is that speech therapy, I think, and maybe to a bit lesser extent OT are falling behind in, and we need to be able to innovate, because that's the way that people are going to access services more and be able to avoid the stresses of life that that you've spoken about, Francesca.
So another really great segue, because let's get crystal balls out and think about the future, the next 100 years or so. You mentioned this form of therapy has been going for 91 years. So, Fran, what do you think the future of online therapy is?
Well, it's really interesting. I had a class this morning, and I asked them, would you see a doctor online? And everybody said no. Now, these are 20-year-old undergrad students, uni students. And I was really shocked, and I asked them why, and they were worried about whether they could get the same result by seeing a doctor online, and the doctor can't listen to your chest, or a whole range of things. And I was quite surprised, because I thought, well, these are our technology generation, and they're saying no to this. But I don't believe that. I believe that comes from not understanding what the opportunity is. So I think that's and it's also a bit of a knee-jerk reaction. Oh gosh, no, I couldn't do that, without really understanding or knowing and finding out. So I do see it as a way forward. I've seen it. I've seen online therapy in terms of like for a GP consultation. I do think it's a really it's we're growing bigger as a society. We're getting more technologically advanced. We're trying to kind of reach out to people who are in kind of marginalised areas, or in remote areas. So I do see it as the way kind of forward, and I think it's just helping people come along. I shouldn't say with us, but along for that ride, with us, and really. But I think you have to understand what it is first, because I think that we all fear change, and we fear that we're so used to this medical model. And this I'm the expert and you're my patient model, that it's really hard to step away from that. And I even know I find it hard to step away from that. So I do think that, with time, we will see, another 100 years, I don't know. Who knows?
So it's inevitable. What kind of innovations do you think we'll see in the online therapy space, Ed?
Well, the sky's the limit, really. I don't think that we'll think of it as online therapy anymore to start off with. I think it'll just be a tech platform, and you won't really make you won't take much notice of where your therapist is, or compared with where you are geographically. I think to be able to track people's movement, figure out what's happening biologically with them in real time, to affect interventions for, say, sensory regulation, behavioural management. That's stuff that's emerging in medicine, but it's still really expensive, so we don't use it as much in allied health and in this kind of practice, in private practice. But it, I think, will be something that people see as natural, and something that they won't they won't worry about, they won't think about. I mean, think of the smartphone revolution in the last 10, 15 years. We've gone from using bricks that can just place call, text, and play Snake, and that's it. And to now, when you've got the world in your pocket. So I think that allied health is going to be on that journey as well.
And I think that brings up another sort of interesting point around, privacy and so on, but really that is an entire podcast in itself. So I want to wrap it up with giving you guys the opportunity to play a little game. 3 words, can be made up words, it can be adjectives, it can be adverbs, whatever you like. 3 words to describe the benefits of online therapy. Who wants to go first? Fran?
Oh, I was going to say throw it to the expert. 3 words. I was going to say before, this isn't 3 words. I could never limit myself to 3 words. But, sorry, I am going to jump in before we play this game, because what you were saying before, Ed, really kind of struck with me. This opportunity for the future for your medical care, for whoever, to be integrated as well, like really integrative in terms of, you're working with your GP and your allied health professionals and everything's kind of seamless and works together, whereas now we're also, it's really like a bit here and a bit there and a bit there. So I think just having this. So the future, I'm going to go for the future, is around integrative, like having something integrative. Uplifting, and I feel like online therapy will give families more hope that they can have kind of access.
So we're going with integrative, uplifting,
hopeful.
Lovely, Ed. Short notice on this,
yeah,
I like surprises.
I'm gonna go with connected. So just to play off Fran there, connected in more ways than one. So connected in terms of we're online now, but connected in the sense that we can also communicate with each other better. We have all the information in one place. It's easier for families to manage, and they can live a normal life rather than having to live this horrible kind of fix my child kind of existence, which was a bit like the Royal Commission a few days ago was talking about this and hearing from parents of kids with intellectual disabilities, and telling us this from the horse's mouth that this has got to change. We can't think of trying to fix people. We're not trying to fix them. We're just trying to support them to live life the way that they want to live. Connected is the first one I would say. Now, number 2. Let's say evidence-based. I guess that's something that we've got to really remind people of, that this is this coming from the science. It's not something we've made up. It's not a gimmick. It's not something that is our own kind of intellectual property. It's something we're out there to share. We want other people to be doing this stuff because we want everyone to be able to use it. And the last one to link in with that point is access. Being from the bush, I just want people to have a chance, to have the same chance that anyone in the city has to access quality allied health services when they want and how they want. It's not good enough that we can't do that at the moment, and Umbo is, I know, going to solve that.
Okay, that's a really good way to end. Thanks to both of you. That was a really informative half hour or so. We are out of time. Learned lots of things. One of them is that you don't like 3-word answers, but that's okay. We still got the point across. Thanks, Ed. Thank you, Fran. Hope everyone's enjoyed listening to the show A Clinician a Click Away today. We will be releasing our show notes, of course, on the website. Do follow us on all the usual social media platforms and our website, umbo, umbo.com.au. I'm Weh Yeoh. Till next time, speak to you later. Thanks. Bye.